आत्मगौरव भाव लेकर देश आगे बढ़ चला है। पथ सदा हमने चुना वह विश्व का जिसमें भला है। एक बार पुनः हम सभी विशिष्ट अतिथियों का स्वागत करते हैं, अभिनंदन करते हैं। अब मैं हमारे निदेशक महोदय जो हमारी प्रेरणा स्रोत हैं उनसे अनुरोध करूंगी कि वो अपना स्वागत उद्बोधन से हम सभी को प्रेरित करें। आदरणीय निदेशक सर।
Respected Dr. Rajiv Bahel, Director General ICMR and Secretary Department of Health Research, Government of India, Dr. Alka Sharma, Additional Director General ICMR, Dr. Richa Pandey, Senior FA, Financial Advisor ICMR, Dr. Sarita Nair, Head Policy and Communication ICMR, respected principals and teachers, dear colleagues, and most importantly, the young students who have joined us today. It is my privilege to welcome you all to SHINE 2026, Science and Health Innovation for the Next-Gen Explorers at the ICMR National Institute of Malaria Research. Well, you know all about, about ICMR. ICMR is an apex body for formulation, coordination and promotion of biomedical research, and it is a 115 years old organization. NIMR is a part of the organization. To tell you a couple of lines about NIMR. So in the 60s, India had nearly done with malaria with the appropriate policies in place. But in the early 70s, there was a big surge in malaria cases as well as deaths, and a need was felt to establish a research institute for malaria. And NIMR was established in the year 1977 to conduct research to find solutions to the challenges of malaria control. And since then, we have been working at Delhi and also at our field units to find solutions to improve diagnosis, treatment, preventive measures. Today is a very special day for us. This is the second edition of SHINE being inaugurated here and also at different ICMR institutes and also its field units and MRHRUs and other places. This initiative reflects ICMR's belief in the scientific curiosity should be nurtured early, and that the next great breakthrough in medicine could be from one among you sitting here in this hall. India is rapidly emerging as a global leader in science, technology and innovation. The vision of Viksit Bharat 2047 will need efforts from all the sectors, including researchers, innovators, public health scientists who can solve the health challenges of tomorrow. ICMR has been at the forefront of protecting the health of the people of India through the cutting-edge research, disease surveillance, diagnostics, vaccines, and public health innovations. Today, you will interact with the ICMR leadership, scientists of the institute. You will visit the research laboratories and will also explore the scientific exhibits and witness how research is translated into solutions. So I encourage you all to make the most of this opportunity. I will also like to thank all the teachers and principals who have encouraged the students and have also accompanied the young learners. I express sincere gratitude to Dr. Rajiv Bahel sir for his visionary leadership and constant encouragement in promoting science outreach and nurturing the young talent. Once again, I extend a very warm welcome to all of you. Jai Hind.
बहुत आभार सर। सच में शब्द कम हैं, अतिथियों के लिए कृतज्ञता अनंत है। हमारे माननीय प्रधानमंत्री जी ने आह्वान किया था, विकसित भारत 2047 की संकल्पना रखी थी, जिसमें विज्ञान, नवाचार, अनुसंधान युवाओं को सशक्त करने का माध्यम बनेगा और विकसित भारत का स्वप्न साकार होगा। ICMR-SHINE इवेंट इसी दिशा की ओर अग्रसर एक कार्यक्रम है। एक विचार को प्रसार की उतनी ही आवश्यकता होती है जितनी कि पौधों को पानी की आवश्यकता होती है, वरना दोनों ही मुरझा जाएंगे, मर जाएंगे। ये हमारे आदरणीय डॉक्टर भीमराव अंबेडकर जी के शब्द हैं। हम बहुत ही गौरवान्वित हैं कि आज हमारे यहाँ पे शाइन वेबसाइट का लॉन्च होगा और राष्ट्रीय प्रतियोगिता की घोषणा, एक शॉर्ट वीडियो स्क्रीनिंग भी होगी। और मैं डॉक्टर आदरणीय सरिता नायर मैडम को, जो कि प्रमुख हैं पॉलिसी एंड कम्युनिकेशन डिवीजन ICMR, उनसे आग्रह करती हूँ कि वो आए और वेबसाइट लॉन्च करें। बहुत बहुत आभार।
Thank you, ma'am. Thank you. Good morning, everyone. Respected DG sir and respected dignitaries on the dais. It's a real, the pleasure to see you all here. And today, as sir said earlier, that, maybe one among you could be the future scientist, right? And the discovery might be coming from there and not from here. Are we all ready for that? Thank you. So today together we are also going to launch the SHINE portal, the SHINE website. I request our DG sir to kindly do the honors. Before that, let me also acknowledge the team which was behind it. So that was from our Dr. Uday Ravi, then our IT team, which is Dr. Pulkit, Dr. Neeraj, then we have Dr. Shudukti, Dr. Debjyoti, Dr. Deepak, and Team GHS. So let's all have a great round of applause for them. And now I request our DG sir to kindly launch the website. Can you please give that to sir? Oh. 1 second. 1 second, sir. We're just... Go ahead. Yeah, sir. Sir, kindly do the honors. नहीं, sir के पास है. Yeah. Okay. So this is going to be a website. Thank you, sir. So this is going to be a digital platform where your scientific curiosity, we'll also have some videos there. You can ask questions, and this is a great platform for you all to, ask your questions, seek for information. The next is our official launch of the national competition. So here we are all going to be witnessing a great moment. This is a national competition where you will all be able to participate, and it's where you will have free entry to it. The theme of the competition is Igniting Scientific Curiosity Among Youth for a Viksit Bharat 2047. This competition is going to be, what you have to do for it. So you have to look around, find out what is of public health, a problem that actually you are curious about. You want to find solutions. So you see for what is available there. You can also use AI tool. And once you have that, do a little research on that, write it down, then come up with the solution, and then please submit it using, just a 2-pager where you write down everything. So we have a short video for that as well. Can I have the team to please play out that video? The national competition.
The ICMR-SHINE national level competition is open to students of grades 9 to 12. Students do not register themselves. Every school appoints one nodal officer. It is usually the principal or a science teacher. That officer registers the school once, then submits an entry for each participating student. Registration takes 4 steps. Register the school, verify the email, set a password, then add students. Start with the school's 11-digit UDISE code. The portal checks it against the national database and fills in the name and address automatically. Next, the office's own details, full name, designation and mobile number. The email address entered here becomes the login ID, so check it carefully. Every code and notice goes to this address, except the undertaking. On the live portal, you will also type a short captcha here. Submit, and a 6-digit verification code is emailed straight away. Enter that code to confirm the address. This proves the school controls the mailbox. The code expires shortly and can only be used once. Now choose a password, at least 10 characters. A short phrase of unrelated words is both stronger and easier to remember. The account is active immediately, and this dashboard belongs to that one school. Coming back another day, the officer signs in from the login button. The registered email address and the password just chosen. Again, the live portal shows the captcha at this step. A fresh one-time code is emailed on every sign-in, so the account stays protected even if the password is ever guessed. Back on the dashboard, choose Register a Student Candidate. One form per student, full name, date of birth, class, and the language of the submission. Attach the 2-page PDF. It must open with a self-introduction of no more than 100 words and stay under 5 megabytes. Submit, and the entry is recorded. There is no limit on the number of students a school can register. One officer submits every entry. The form is identical each time. Details, language, PDF, submit. Both students now sit under the same school. Every entry stays listed on the dashboard with its status and the time it was last updated. Entries stay editable until the deadline, and the list downloads as Excel. Submissions close on the 11th of September 2026. Thank you for using the ICMR-SHINE portal and best wishes to all participating students.
Yeah, so what do you get? What do you get when you actually participate in the competition? You get a certificate, and 100 top winners also receive a cash prize of 1,000 rupees each. I encourage you all to participate, and also please pass down this information to your friends so that they can also participate, right? Can we look forward to more participation from all the students who are there? Yes, thank you. So now we move on to the next part, that, we always ask questions, right? So one question which scientists at ICMR asked was about how to bring the patients raising, about a bold question. What happens when someone lives hours away from a hospital in a deep forest, and if requires some kind of a support, if a help could be provided there? So we are going to be screening one short film. It's about our groundbreaking innovation, where we have a mobile stroke unit. So that stroke unit, which was fully equipped, you could say it as a hospital on wheels, packed with life-saving technologies for a patient who has just suffered a stroke. So as you all know, when a stroke strikes, brain cells die every minute, making rapid treatment the difference between life and death. So I would actually request you to watch a movie which is going to be coming, a short one, and to pay attention on how engineering, medicine, and big picture thinking came together to build a solution that bridges massive geographical distances and saves lives right where people are. So Can I request the team to please roll on the film?
Every minute during a stroke, nearly 2 billion brain cells are lost. Wait, 2 billion every minute?
That's right, young friend. When it comes to stroke, every second counts.
And you know a thing or two about racing that clock, don't you?
I spend much of my life asking a simple question. How can science help us save lives faster?
Ah, Dr. Author Singh Painter, a pioneering Indian physiologist, the first Indian physiologist to be elected a Fellow of the Royal Society, and later the Director General of ICMR.
And one of the biggest challenges ICMR faced was this. For many stroke patients, getting treatment in time wasn't easy. For years, stroke care in India had one stubborn problem: distance. Patients in remote hills and forests sometimes took nearly a full day just to reach a hospital that could treat them.
A whole day? But every minute is supposed to matter.
Exactly. So we at ICMR asked a bold question. What if, instead of the patient racing to the hospital raced to the patient? We built a mobile stroke unit, a fully equipped vehicle with a CT scanner, a point-of-care lab, clot-busting medicines, and a live video link to the specialist doctors sitting hundreds of kilometers away.
A CT scanner inside a moving vehicle?
Yes. We tested it first in some of the toughest terrain we could find, in the remote northeast, and it worked. Diagnosis and treatment could now begin the moment the vehicle reached the patient's doorstep.
So, did it actually save time?
Time that once took nearly a full day came down to about 2 hours. Deaths dropped by a third, and disability fell 8-fold.
8 times fewer people left disabled? That's incredible.
And once the unit was linked with the emergency ambulance network, it could reach patients across a 100-kilometer radius. Trained nurses screened hundreds of suspected cases, and most patients were treated right from their own homes. That idea has now been handed forward to the state government of Assam. So this life-saving service keeps growing. A hospital on wheels, reaching a little further every year.
From racing to the hospital racing to you. Every minute really can be saved.
That's the spirit, Dr. Curio. Science moves fast, but it moves for people.
Every minute matters. And now, so many more lives can be saved.
So I would like to acknowledge the team behind the making of the movie. So the MSU team, of course, yes, but then we also have young professionals who have been part of it, and Dr. Ina Dogra Gupta, who has led the making of the movie. So thank you so much. And to the students, please ask bold questions, because once you start thinking, asking questions, then of course you would be behind, how to find solutions for that. Thank you.
बहुत बहुत आभार मैम। आप सभी की उपस्थिति हमारे लिए गरिमा का विषय है। आपने हमारे इस कार्यक्रम में प्राणों का संचार कर दिया है और हमारे लिए अत्यंत प्रसन्नता का विषय है कि हमारे मध्य ऐसे विराट व्यक्तित्व के धनी विराजमान हैं। आज के इस महत्वपूर्ण एवं प्रतिष्ठित क्षण में आज हम जिस व्यक्तित्व को उद्बोधन के लिए आमंत्रित करने जा रहे हैं, उनका आगमन, उन आदरणीय का आगमन हम सभी को उल्लास से भर देता है और आपको सुनने के लिए लालियत हम सभी बेसब्री से प्रतीक्षा कर रहे हैं। सर, कुछ पंक्तियों से मैं आपको आमंत्रित करती हूँ। दीप से जलना ना सीखें, दीप से मुस्कान सीखें, सूर्य से तपना ना सीखें, सूर्य से उत्थान सीखें, सोचना है हम खुद यहाँ अंकित कहाँ हैं, राह चलना ही ना सीखे, राह का निर्माण सीखे। मैं बहुत आदर के साथ आमंत्रित करती हूँ डॉक्टर राजीव बहल सर को कि वो आए और बहुत बहुत धन्यवाद सर।
My colleagues on the dais, Dr. Alka Sharma, Dr. Anup Anvikar, Dr. Richa, Dr. Sarika, Sarita, and all the principals of the college schools which are here, all the teachers, and my dear students. It is a pleasure for me to talk to you for a couple of minutes about this program and about science in general. And then we will open this up for any questions, any interaction you may want to have with me and with us. You have just seen how scientific questions, thoughts can be linked to saving lives. Now, what is the science which was just shown? That we have a CT scan inside the vehicle. But why? There was only one reason. We need a CT scan inside the vehicle to decide what to do, when stroke occurs. So stroke is of two types, one which is a bleed in the brain and one which is a clot in the brain. So if it is a bleed, you treat it differently. If it's a clot, you treat it differently. So that was the science, that we found that there are two types of strokes, and if you have a clot in the brain and you give the right medicine to dissolve that clot, then you can save a patient's life. But we could not do it because CT scans were only in big hospitals, big cities, very far away. And therefore this bioengineering thought, bringing together the science and engineering, we came up with this idea of creating a mobile stroke unit that was able to provide service right near the patient, and it would be as soon as a patient with suspected stroke was found, the patient would go there. So that is how you bring medical science together with bioengineering, together with actual implementation. So that type of research is something that touches lives of people. We call this more development and implementation, translation and implementation research. This is different from what developing a new vaccine or a new drug or a new therapy or a new diagnostic is, which is also very important. And we also do that. So, as Dr. Anvikar said, we have started this program for you. Why? Because we see Viksit Bharat in you. For me, you are the Viksit Bharat. When you grow up, when you are at the prime of your careers, at that time we are very hopeful that India will be a developed country. And no country can be a developed country if it doesn't do well on research and innovation. When we find new things, when we do research, when we actually innovate, when we make new things, only then we become a developed country. You can look around the world and see that any country that became developed its intellectual property, developed its science, technology, and moved forward with that towards becoming a developed country. So will we. And our goal is to incite you, to excite you about research, for you to see what research can achieve, for you to know that there are more than 300 medical doctors who work in ICMR as medical scientists, for you to know that a lot of doctors can also become scientists, and a lot of other people, other scientists in different domains, including biotechnology, biochemistry, bioengineering, and other life sciences, chemistry, biophysics. We have a large number of scientists, about 1,000 of them, working for ICMR, who are working on different types of research to bring to the country new health technologies and new innovations. So the idea is that you engage with us. You saw we have a new program. Dr. Sarita told you, you can win not only 1,000 rupees. You can not only win 1,000 rupees, if you win, 100 of you can do that, but also, more importantly, engage with science, with research. And we have given you AI, artificial intelligence, as a tool to do that. We have said, you may not know everything, but you can learn even using artificial intelligence. So use it well. Why did we do that? Because we think artificial intelligence is a technology of the future. Everybody needs to know how to use it well, not to use it incorrectly or simply blindly, but how to use it in combination with your own brain. So the artificial intelligence, when combined with natural intelligence, which is in you, then becomes the most powerful tool for us to think about how to use science. ये आवाज कम क्यों हो गई? To use science for the good of humanity. So I don't want to say anything more. We will keep time for you to ask questions, but I will ask all of you to say 3 things after me with some passion. जोश के साथ हम 3 नारे लगाएंगे. पहला नारा होगा जय विज्ञान, दूसरा जय अनुसंधान, और फिर जय हिंद. ठीक है? सब बच्चे तैयार हैं? जय विज्ञान, जय अनुसंधान, जय हिंद, भारत माता की.
बहुत बहुत आभार सर, हम सभी को प्रेरित करने के लिए. इस कार्यक्रम की सबसे बड़ी विशेषता है कि छात्रों को ये फोर फ्रंट पे रखेगा और उनकी प्रतिभागिता इस कार्यक्रम की सफलता को निश्चित करेगी. आज के इस ज्ञानवर्धक कार्यक्रम और प्रेरक चर्चाओं के सफर में याद रखिए कि हमारा उद्देश्य सिर्फ सीखना, सहयोग करना और परिवर्तन को गति प्रदान करना है. तो अब हम आगाज करते हैं अगले सत्र का, जिसमें फेस टू फेस हमारी सशक्त जो नेतृत्व है, लीडरशिप है, उसके साथ छात्रों का इंटरेक्शन होगा. तो
So let's begin. हम शुरू कर लेते हैं. चलो फायर करते हैं, मगर क्वेश्चन से. ठीक है? रेडी? Who is going to ask the first question? The explore, the innovate, the inspire. Who is the one? Which group? Please raise your hand. एक तो सवाल है. Yes or no? Otherwise, sir is going to ask you a question. आप पूछ लो.
कह रही हैं कि अगर आप पूछ लो तो अच्छा है, नहीं तो हम पूछेंगे, फिर आपके टीचर्स को बोलेंगे आपसे क्वेश्चन पूछने के लिए। तो आपका कोई भी क्वेश्चन हो, कोई भी चीज जानना चाहते हो, कोई भी आपके मन में सवाल उठता हो
we have-
रिसर्च को लेके,
yes.
तो आप पूछ सकते
Yes, sir,
हैं।
we have one. Okay, Mike. Can you have the mic?
Hello everyone, I am Manvi from Team Curiosity. So my question is, for example, any disease or some kind of virus comes, for example, corona came. So how can we find a cure immediately? Like you said na ki we have everything to find a cure and vaccines and everything.
वेरी गुड क्वेश्चन। आपका बेटा नाम क्या है?
Manvi Sehrawat.
मानवी बेटा बैठ जाइए। अभी आपका बहुत अच्छा सवाल पूछा आपने कि अगर कोई सम न्यू वायरस वर टू कम टू इंडिया, हाउ आर वी प्रिपेयर्ड टू fight that virus? So I'll say this in two parts. First part is that we need a system like a radar system. Like when you fight a war, suppose an enemy plane was coming to our territory, first we have to identify that enemy. And that part we call surveillance. So we have set a whole surveillance system in India where anybody has any disease, we are looking at what is causing that disease. We have about 170 labs that ICMR is supporting all across the country, which are looking for any new virus by looking at whatever people come with severe disease, चाहे उनको निमोनिया हो, चाहे उनको डायरिया हो सीवियर, चाहे उनको बुखार जो ठीक ना हो रहा हो, चाहे उनको मेनिंगो एनकेफेलाइटिस यानी कि न्यूरोलॉजिकल जो ब्रेन से रिलेटेड इन्फेक्शन है वो हो, उसको हम पहले देख रहे हैं। उसकी हम हर हफ्ते हजारों सैंपल्स की जांच होती है, ये देखने के लिए कि कोई नई बीमारी तो नहीं आ गई जिसके खिलाफ हमारे पास डायग्नोस्टिक नहीं है, या हमारे पास वैक्सीन नहीं है, या हमारे पास कोई ट्रीटमेंट नहीं है। तो पहला पार्ट, जैसे कि एक वॉर में रडार सिस्टम हमारा होता है, वो एयरफोर्स को बताता है कि ये चीज यहाँ से जहाज दुश्मन का आ रहा है, ये ठीक नहीं है, ये ड्रोन आ रहा है, इसको कुछ करना पड़ेगा। फिर आपको पता है कि हमारी फोर्सेस क्या करती हैं, फिर उसको वो मारते हैं, चाहे हवाई जहाज से, चाहे मिसाइल से, चाहे किसी टैंक से, वो किसी भी तरह से उसको खत्म करते हैं। वो उसको हम काउंटर मेजर बोलते हैं। तो वो काउंटर मेजर हमारे हैं वैक्सीन, वो काउंटर मेजर है डायग्नोस्टिक टेस्ट, वो काउंटर मेजर है ट्रीटमेंट, चाहे वो मोनोक्लोनल एंटीबॉडी हो या एंटीवायरल ट्रीटमेंट हो। तो इन दोनों चीजों के लिए भारत सरकार ने ICMR को दो बहुत बड़े प्रोग्राम दिए हैं। पहले का नाम है नेशनल वन हेल्थ मिशन, जिसमें कि हम ये सर्वेलेंस को बहुत स्ट्रांग कर रहे हैं। उसमें लोगों की बीमारी की सर्वेलेंस भी है, लेकिन जो हमारा गंदा पानी जाता है, जो वेस्ट वाटर जाता है घरों से, जैसे जो नाले में फाइनली पहुंचता है, घरों की जो टॉयलेट्स का पानी, जो सुएज का पानी, उसको भी लेके कॉन्स्टेंटली हमारे साइंटिस्ट उसको टेस्ट करते हैं कि उसमें किस तरह के वायरस हमारी कम्युनिटी में सर्कुलेट कर रहे हैं। आइडिया ये है कि कोई भी नया वायरस पकड़ा जाए। और जो हमारा पैंडेमिक प्रिपेयर्डनेस एंड रिस्पांस एक बड़ी स्कीम और है, उसके अंतर्गत हम ऐसी प्लेटफॉर्म बना रहे हैं जिससे कि कोई भी वैक्सीन सिर्फ 3 महीने में ही बन के तैयार हो जाएगी। तो पहले से ही उन पे काम करके वो प्लेटफॉर्म्स को तैयार करके रखा है कि जैसे ही कोई नया वायरस आएगा वैसे ही उसके ऊपर वो वैक्सीन बना दी जाएगी, और वैसे ही उसके लिए एंटीवायरल या मोनोक्लोनल एंटीबॉडी बनाई जाएगी जल्द से जल्द। इसको हम 100 डे प्रोग्राम कह रहे हैं कि 100 दिन के अंदर अंदर ट्रीटमेंट जो है वो पूरी तरह से तैयार होगा। लेकिन जिन वायरसेस का हमें आज पता है, उनके लिए पहले से ही हम वैक्सीन तैयार कर रहे हैं। जैसे एक बीमारी होती है क्यासानूर फॉरेस्ट डिजीज। अब हम पिछले 2 साल में हमने बहुत मेहनत करके एक नई वैक्सीन बनाई है, वो वैक्सीन एक कंपनी से बनवाई है, अब उस वैक्सीन का ह्यूमंस में ट्रायल हो रहा है, अभी भी ट्रायल खत्म नहीं हुआ, होने वाला है, तो वो वैक्सीन अब तैयार हो जाएगी। ऐसे ही निपा वायरस एक डिजीज होती है, एक इन्फेक्शन है जो केरल में हुई और वेस्ट बंगाल में भी होती है, एक बार हुई अभी वेस्ट बंगाल में, केरल में हर साल हो रही है। उसके लिए उसका ट्रीटमेंट एक मोनोक्लोनल एंटीबॉडी भी हमने तैयार कराई है, वो भी ह्यूमन ट्रायल्स में है। तो इस तरह से हर एक बीमारी जो अभी है या जो आ सकती है उसकी पहले से ही तैयारी करके रखना, ये आईसीएमआर का एक बहुत बड़ा काम अब बन चुका है। इज दैट क्लियर? समझ में आया बेटा? और कोई और क्वेश्चन? ऐसा सवाल बहुत अच्छा है कि हमें पता होना चाहिए। अच्छा, आप लोग क्या कर सकते हैं? अगर एक आपको पता है कि एक कम्युनिटी पोर्टल भी है जिसमें अगर आपको कोई ऐसे लोग दिखते हैं कि जिनको कोई अजीब सी बीमारी हो रही है, आप उसको रिपोर्ट कर सकते हैं गवर्नमेंट को। वो एक पोर्टल है IHIP का, तो उस पे जाके आप कह सकते हैं कि मेरी कम्युनिटी में मैंने 2 ऐसे पेशेंट देखे जिनको कोई इस तरह की बीमारी है। दिल्ली में तो इतनी जरूरत नहीं है क्योंकि अस्पतालों में लोग पहुंच जाते हैं। जो दूर दराज के गांव, दूर दराज के इलाके हैं, वहां पे कम्युनिटी को भी हमने एक्टिवेट करने के लिए गवर्नमेंट ने सिटीजन्स को भी ये पावर दिया है कि रिपोर्ट करें, ताकि उनकी इन्वेस्टिगेशन होके फिर अगर कोई वो नई बीमारी हो तो इमीडिएटली उसके ऊपर एक्शन लिया जा सके। अदर क्वेश्चंस?
The mic is
बेटा
not
माइक्स
on.
में यू स्पीक विद।
Sir, my name is Tanya Singh from Team Explorers, and my question is cancer a virus? If so, like how can we cure it by vaccine? Or what is the development for curing the cancer by vaccines?
Thank you. It's a very interesting question. Answer is a bit nuanced, partly right and partly not. So all cancers are not caused by virus. At least we don't know if all cancers are caused by virus. But there are 1 or 2 cancers that we know, 2 for sure. One is hepatitis B virus that causes liver cancer. And the second is human papilloma virus or HPV that causes cervical cancer. And these 2 cancers are eminently preventable by vaccine. We already have these 2 vaccines which can prevent the cancer. So the government of India has recently, HPV or hepatitis B has been in program for several years, and all babies, in fact all of you have been vaccinated against hepatitis B. If you were born in a hospital or if you went for your treatment, your parents must have taken you, but you should all check, are you vaccinated against hepatitis B? But this year, earlier this year, the government of India made a program for girls, 9 to 14-year-old girls, to give them human papilloma virus vaccine or HPV vaccine. This HPV vaccine is highly efficient, highly efficacious in preventing cervical cancer throughout the life of a person. So for everyone, every girl who is not vaccinated, you should check with your parents, with the doctors, can you get a vaccine for HPV? This is 2 things you can do. But your second part of the question is something completely new, which I will talk about, which is that for some cancers, cancer is a disease not necessarily only of a virus. Cancer is a disease of immune system. This is the new knowledge that we have gained. That in everybody, even in you and me, particularly me at advanced age, much older than you. Every day, one of my cells will turn into a cancerous cell. Something will happen, either radiation or something, or just a mutation. It could develop into a cancer. But my immune system is roaming around everywhere in my body. Every day it checks, is there anything which is not my own cell? Is it anything which is not like Rajiv Behel? That it finds that and it goes and it kills that cell, even if it is my own cell. But that is a preventive mechanism against cancer. Immune system does not only help us against infection, immune system also helps us in fighting cancer. This is the new knowledge in the last 20 years that we have gained. And why cancer actually happens in the end is because our immune system is either not able to see that, so it is like my radar is not able to see that its cell has turned cancerous, so it keeps growing and my body does not recognize it, or I simply cannot do anything to kill that cancer cell. It has somehow fooled my system to say not to kill it. So when we are now talking about vaccine in a different way, not against a virus, we are talking about vaccine in terms of immune therapy, something that changes our immune system to now recognize cancer and go and kill it. And those types of treatment are the new advance that medical science is now making. It is called, for example, CAR T-cell therapy. It is a type of immune therapy where we change the body's cells to now being able to recognize the cancer, and then they are able to kill the cancer cells. In this way, now about 25% of cancers have become treatable, almost fully treatable, based on immune system therapy, and has improved lives of many cancer patients. There are a lot of immune therapies that are available, different types. There are treatments, there are antibodies, there are these cells. So all these are focused on the immune system. So for you, two messages. One, 2 viruses can cause cancer. You should be vaccinated, and everybody else in your community, try to see that they are vaccinated. And second, that tomorrow's research will make cancer a curable disease. And this is the research that is happening in many parts of the country, many parts of the world. You will be very happy to know that India made its own cancer immune therapy in IIT Bombay and Tata Memorial Hospital. And they were supported by ICMR along with Department of Atomic Energy, Department of Biotechnology to do that. So our own scientists are now able to do those things which once we thought only are done in United States and in Europe. So, excellent question. You could all be, one of you could be one who could find a treatment of any type of cancer. So, this is the research that is going to be there for the next 20, 30 years, that we will try to make cancer into a curable, at least a controllable disease, and it no longer will be a death sentence. Thank you. Good question. Very good question.
Any other question? Any other question? We have 2 girls who have asked question. Can we have a boy? Yes, there.
The boys
Yes,
are
yes,
being
yes,
left behind.
yes.
Okay. She's worried.
Hello. Sir, my name is Shreyansh and I am from Innovators Club. My question is that the treatment like mobile vehicle parkings and that other treatment of from vehicles are also reached in rural areas and on the tribes which reach more requirements of treatments and medicines?
Yes, very good question. I will repeat your question. What you are asking is that has this technology, for example, the mobile stroke unit, is it reaching the poorer people, the tribal people, the rural people of the country? So this type of work was started also in Germany along with India. And in Germany and in other countries, now in US, mobile stroke units are also functional, but they function only in the big cities. This is the difference that ICMR and India decided to do it in rural Assam, where we have tribal people, we have hills, people live very far from cities, transportation is very difficult, and this is the idea that we should reach every Indian citizen we should reach when we go. At the moment, I cannot say that we have reached everybody with these units, but there is a lot of interest of different state governments. Telangana, Jharkhand, many of those governments have asked ICMR whether we can support them to set up such units. So that is the idea, that eventually we want that every Indian citizen should get high quality services. However, when you all become, for example, some of you will become doctors, you should think like that also with you, what I can do. Because if everybody wants to work in Delhi and Bombay and Kolkata and Chennai and Hyderabad and Bengaluru or Ahmedabad in the tier 1 cities or in tier 2 big cities, then there is no chance that we can take healthcare to every Indian citizen. It requires doctors, it requires nurses, it requires medical professionals, it requires scientific people to go and do the science also for those problems that exist in those areas. I myself find it very difficult. For example, we have a tribal health institute in Jabalpur. But people want to live in Delhi, Bombay, Kolkata, Bengaluru, Chennai, all these big centers. They don't necessarily want to go and work for tribals. And we find it difficult to find people who will go and do that. So I am also requesting all of you young people to think that this entire country is yours. Don't think I belong to only one city or only one state. This is your country. You should look for the best opportunity to work and the best opportunity to serve wherever in the country you are needed and wherever you find the best opportunity. Okay? Any last question?
Thank you.
Sir, I have one more question.
So one last question. Who has one more? Beta, दूसरों को भी chance दे दे.
Okay, sir. Okay, ma'am.
Thank you. Yeah.
हाँ जी, पूछो बेटा. इनको माइक्रोफोन दे दो.
Hello. My name is Lavanya. I am from Explorer team. I want to ask, I have researched many times and I only got the answer nanobots for cure of all cancer. I want to know about nanobots in detail and I want to ask that if it is developing in India. Nanobots.
Nanobots. So a lot of this nanotechnology, we have several institutes in India that are working on nanotechnology for different types of treatment. And I don't know if any one of them has yet reached people, but we are working on several nanotechnology-based treatments including treatment of cancer, but also other treatments. For example, recently, not for cancer, but for a newborn with very severe jaundice, there was a nanoparticle, nanomanganese particle that was tested and has been found to reduce the bilirubin completely low. But we are working, and the scientists of India are working on every technology now that is globally kind of looking in the horizon as a possibility. Okay? Anything else? Thank you.
Sir, can we have a group photograph so we can move towards this center place, sir? Thank you. And I know you have many questions. We can continue this afterwards, right? Yes, sir.
प्लीज फ्रंट साइड में आ जाइए एंड यू कैन स्टैंड एट योर, हम थोड़ा सा ये पहले 5-6 रोज में सब लोग आ जाए.